Good morning, and welcome to this week's episode of Ask Dr. Murphy. I hope everyone is doing well today. My name is Katie Berg. I'm a research study coordinator with the Havey Institute, and I'll be leading today's discussion. I'd like to welcome and introduce Dr. Robert Murphy. Dr. Murphy, how are you this morning?
Doing just great. Thank you.
Dr. Robert Murphy is the executive director of the Havey Institute for Global Health and the John Philip Fair Professor of Infectious Diseases here at Northwestern's Feinberg School of Medicine. He answers your COVID, infectious disease, or public health questions each week here on the Havey Institute for Global Health's Facebook page. Today, Dr. Murphy will be addressing the latest headlines and our lone U.S. COVID statistic through today, May 23rd. We invite you to submit any questions down below in the comments or via any of our social media linked in the description. Starting with that lone U.S. COVID statistic, average COVID deaths per day in the last reported week were 51. In the same week in 2024, we saw 71 daily COVID deaths. Dr. Murphy, your reactions to those numbers and the general state of COVID in the country?
Well, it's not going down any further. We've been at this 50 level for quite a while, and since the winter season kind of dropped off. And if you notice the difference from the year before, that difference is getting smaller. So what's happening is we're getting to the steady state. In other words, looks like it's just going to be the level unless it starts to drop off at some particular point. But this may be what we have to live with until we get either a better vaccine or more people vaccinated.
Absolutely. And on that note, on COVID vaccines, there was just an approval for a COVID vaccine, and a lot is changing in the general realm of vaccine approvals. Could you fill us in on all that?
Yeah, so on Monday, the U.S. Food and Drug Administration approved the Novavax COVID-19 vaccine. So Novavax is the vaccine that's made in the traditional way. It's not an mRNA vaccine. It works just as good. It's a little bit more cumbersome to make, a little bit more expensive, takes a little bit longer time to develop the new vaccines based on what strain you want to gear them for, but it works just fine. But the approval now is for all adults 65 and older, or anybody over 12 who has at least one health problem that could complicate things. So that's a restriction. And so the vaccine will not be paid for by many insurance companies or government plan if you don't fit that criteria. So that's a change. It's probably not going to make a big difference in terms of the overall mortality, but it is a restriction compared to how this had been done in the past, where basically anybody that walked in could get it. Now they have to say, I have an underlying disease. I don't know how they would prove that. They have to have a letter from the doctor, or they can just tell the pharmacist that's giving the vaccine or whoever is giving it, I mean, there's a lot of people with underlying diseases. So there's going to be a lot of people really eligible to take this thing. So we'll see.
Yeah, we'll have to keep an eye on that uptake. There was also some more news about a delay potentially for that Moderna recombinant vaccine, and that is flu and COVID.
Mm-hmm. So Moderna, who makes the COVID vaccine, they've added a flu component to it. So it'll cover COVID and the flu together. They were trying to get this approved for this coming season in the fall here, but they've been basically told to wait until this big phase 3 trial that they're doing is completed. So the approval is going to be delayed till the 2026 flu and COVID season, respiratory season. So that's okay. You can still get, separate vaccines. This would just be a little bit more convenient. And, this would be great because these are the two big two of the three big viruses that cause these winter outbreaks. And to put it into perspective, COVID is worse than the flu. There's more people that got COVID than flu. Last year, it was 47,000 Americans died from COVID. It was much more than died from the flu. And 231 children died from COVID-related complications. So it's very close to what happens with the flu. So, but this is in addition to the flu. So it's going to end up in this kind of flu chronic epidemic, endemic type affair. But it's going to be, so far, it's a little bit worse.
And looking forward to that next respiratory season, the meetings between many health agencies for the US just concluded yesterday, where they were looking into what strain to target for those future COVID vaccines.
Yeah.
Could you break down some of those discussions?
Yeah, I mean, like we change the flu vaccine every year. And we've been changing the COVID vaccine, as it evolves. And there was a very significant debate whether we need to change the current COVID vaccine or not. The current circulating strain is this LP 8.1. But it's very closely related to the JN1, which has been around for a while. And so the recommendations that they are from the FDA to continue to target the JN1, the current vaccine that's out there. So they're basically saying don't change for next year. Now, not everybody agrees with that, and I think it's a healthy discussion. WHO kind of took a middle position, saying LPA1 suitable alternative, and the European Medicine Agency is preferentially recommending updating the vaccine to cover the newer variant. So we're kind of all over the place. Probably you're not going to go wrong, no matter what you do. You're going to get plenty of protection from the JN1 because they're all so closely related. But it's not the current circulating virus. So it was a debate, and that's the decision. I think that getting any of these is the way to go because this is worse than the flu. You're going to have more deaths from it.
Mm-hmm. And speaking of viruses that are circulating here in the United States, the measles has been going on in these outbreaks for months now. Just a minute ago, the CDC updated their official case count to 1,046 confirmed cases here in the United States. So an increase at about 20 from last week. Dr. Murphy, can you fill us in on all that's happening with measles here?
Yeah, so it just continues on. All these people who are not immune, in other words, they haven't had measles in the past or they haven't had the vaccine, they're just getting exposed everywhere. It's all over the United States now. We've got over 1,000 documented cases with 128 people hospitalized. 3 people have died, which is very typical. It's about 2 to 3 per 1,000. And they occurred in unvaccinated children and 1 adult. And the good news is that people are starting to really worry about this. And there's in Texas, there's an analytics company that showed that 6-month-old babies this year are taking the vaccine. Now, 6 months is early. You can do it at 6 months, but it's recommended typically at 1 year. But this big jump in the 6-month-old is huge. I think it's a really good sign to protect these young children because, of course, they're very much at risk. And so that's a good sign. People are paying attention and they're doing the right thing.
Absolutely. And in terms of last year, I understand there was still, a number of outbreaks, but that was throughout the entire year. We are seeing more measles this year.
Yeah, so, start with the year 2000 when we had no cases reported, period. Okay, well, and then we started seeing upticks and mandates went back in for kids going to school, having to be vaccinated. So last year, in 2024, there were 16 outbreaks in the entire year. And this year we've had 14, and we're not even halfway through the year. We got another, good month and a couple weeks to go to get to the halfway point, and we already basically have as many outbreaks and more cases than the year before. So this is what's going to happen, and these outbreaks are going to continue. 14 outbreaks, 16 outbreaks. There should be 0 outbreaks. So an outbreak is defined, by the way, not as an isolated case. They have to be 3 sort of linked cases. So there's plenty of other cases popping up.
Mm-hmm. And one outbreak that we've been talking about a little bit less, it hasn't slowed down in the poultry in the US, but it seems to have slowed down in humans, is the avian flu, H5N1. Can you bring us up to date on what's been happening with the avian flu?
Yeah, well, we have 70 confirmed cases still. It hasn't changed. One person died in Louisiana. Mostly the disease has been very mild. But does that mean that it's kind of going away? Well, number one, it's not transmitting human to human yet. So that's great. But what's happened here is that the testing has gone down. It's not that the cases have gone down, the testing has gone down, because they've done some studies looking at antibody levels in poultry workers and cattle workers, dairy workers, and they found that 7% of them, or roughly 1 out of every 15 people, has antibodies. In other words, they've had it and they either didn't know it, or they didn't get tested, or whatever. So assuming there's 200,000 dairy workers, and I don't know if that includes the poultry workers or not, but 200,000 is a number that's been floating around that would need the vaccine if this thing gets worse. That's roughly 15,000 people getting infected, not 70. So, it's just super way underreported. It's just amazing. But mortality rate must be very low, because we would have seen that in the past. So the other thing that's happened is that now the number of birds that have been culled because of the outbreak in the poultry farms is now up to 171 million. That's a lot of birds.
That's a lot of birds.
That's a lot of birds.
And exponentially more eggs.
And chicken prices are up a little bit. That's kind of one of the reasons.
Yeah. So we will keep an eye on that and keep our eye on those numbers. Yeah. But finishing off with a very good story for public and global health is that the WHO has agreed and passed the Global Pandemic Treaty. Can you tell us about that big announcement?
Yeah, we mentioned this a week or two ago, that this was ready to go, and that the WHO partners officially met and adopted this pandemic agreement. So this is just a document that sets out the principles, approaches, and tools for better international coordination if there's another pandemic. It's, everybody said they wanted this after COVID came out, and the United States was part of this, but, we have left the WHO. The U.S. representative was involved in developing these guidelines. However, they dropped out and didn't attend the final meeting. But, presumably everyone will follow along with this. And this is just, let's coordinate. Let's make this thing, the next pandemic, let's make it less dangerous. And it's great that this has been done, and that almost all the world except the United States has signed on. But the US was part of the original development of this. So I think they probably would follow the guidelines. I don't know why they wouldn't, but I think this is a great achievement of WHO to deal with the next pandemic. The next pandemic could be worse. This pandemic killed like approximately 1% of everyone that got infected. What if the next one is 5%? That is a lot. So we'll see what happens. But this is a great achievement.
A great achievement. And also of note is that while the US did officially leave the WHO, we are still a part of PAHO, which is the Pan American Health Organization, which is an offshoot of the WHO for the Americas region. So hopefully we'll be following through with things through PAHO in that way.
Yeah, well, that's a little bit closer, the Americas. So, hopefully that will work with them as well.
Absolutely. And on that great note, I'd like to thank you, Dr. Murphy, for your time and your expertise breaking down all the headlines and all the data for us today.
Well, thank you, Katie, and have a great Memorial Day weekend.
Thank you. And thank you all for joining us for this week's episode of Ask Dr. Murphy. We hope you enjoyed. And of course, if you have any questions or comments, please leave them down below or at any of our social media linked in the description. Have a great Memorial Day weekend, and we'll see you next week.